actually, I had seen pain clinics before and didn't ever want to go there because I thought that pain clinics were for people who wanted drugs. And I have the neighborhood app, and somebody on there was talking about a doctor in the same office and how great he was and whatever. So accidentally, I got you because they just sort of assigned me to somebody, which was a happy occasion. Um, I went in, and I'm a difficult patient, so I went in with like lists of things, like what I wanted to achieve, what the problems were, how many, how often I had pain, all these things, and I was like, I'm gonna get this guy. Like he's not gonna know what hit him, and you were so just relaxed, listened to everything, and was like, oh, well, I know how to fix that. I left there and called my parents and was like, this can't be true. Like, it's not going to work, but okay, I'll give it a shot. This is dumb, but all right, whatever. And then I went on Google and looked up RFAs and all the things we had talked about and wondered, like, how did no one ever mention that this was possible? Not one doctor. I'd been to neurologists, I've been to the VA. I've had so many different people that just threw pills at me, even when I was begging not to have pills thrown at me. So we did the RFA, and I will never forget, like the 2 days after, I was feeling great. I think I felt pretty great the same day, but 2 days after, I was going up the stairs in my house and realized it was the first time in like 15 years that I didn't get dizzy going up the stairs. Mm. And that was when I was sold, and like, whatever you can, electrocute out of my nerves, let's do it all. It's been amazing just being able to walk around and not be in pain, or not choose what I'm going to do by how much pain it's going to cause me.
That's great. I still remember you telling me that the
Yeah.
stairs that all of a sudden you went up the stairs and you didn't have that same pain, and then we did a similar thing for the neck, and that too ended up having a fairly good outcome.
Yeah, the neck was actually amazing. I probably wake up 30 times a night, and I have never been a great sleeper anyways. As soon as we did my neck, it was amazing how much more I slept. I still wake up some, but it's not because I'm in pain.
Yeah.
So I'm not waking up trying to adjust and then packing all the pillows around me again, trying to make sure that nothing moves. And I tell my husband it's like defensive sleeping. Once I get those pillows arranged correctly, like, don't touch me, because that's how I'm going to sleep without pain. And now I don't have to do that.
That's so awesome. That's so great. And tell us about things that you do other than the procedures. What have you changed, or how do you try to manage, symptoms, or if it's a bad day, how do you work around that?
It's actually, I haven't really had any bad day. Like, it's so different.
Yeah.
I will say, when it starts to wear off, the feeling of like that nice little calm going away and the pain starting to come back, you're right away, So those are probably the only days, like, as it gets towards the 8 months and I need to repeat it and whatever, as soon as I feel it, I'm making an appointment. But pretty much, like, I don't have bad days. I stand probably 4 or 5 hours at least doing like hobby stuff, and before, my back would lock up, I'd be miserable, had to go to the bath like right afterwards and try to relax everything, and now I just don't do that. I have to modify the way I stand a little bit sometimes, and like the little things that you do when you have back pain, but I'm not coming out of there looking like I'm trying to do every yoga position possible to get my back to calm down. It just doesn't happen anymore.
That's great. So we've clearly had a great outcome. Tell me, what did you like about seeing me, or is there anything specific that you liked about our clinic or our approach?
I feel like I went in there ready to argue with everything you said. I went in there ready to not hear anything that would help, hear the same stuff, like
You were a
lose weight,
skeptic.
move around more, like sorry your back hurts, but go run,
Yeah.
all those kinds of things. And to sit with that goal list and say, these are I want to be able to play with my dog and go walk and get in better shape and all of those things. Like you're the first person that sat there and we're like, yeah, you can do that. We can get you down that road where you can start moving around more if you want. But I didn't feel like you pushed me into a decision. I've had doctors tell me, you have 30 seconds to decide if you're going to let me do this procedure. Like, I'm not answering any more questions. And you sat there so calmly and just went through and I feel like I did kind of hate you with a notebook full of questions, wanting to know like every possible outcome. And I couldn't have been more comfortable.
Awesome. Thank you. No, I really try to do that as much as I can. In fact, yeah, I don't know when I wouldn't when act that way.
Right.
I want to sit down, listen to the whole story, and offer the best options, and go over the evidence base for treatment, and then let you decide,
Yeah.
and you pick. I always try to offer treatments that with the best intention, and only offer those treatments that I would offer to my own family, or
Right.
what I would want for myself. And usually, when the right treatment is done for the right indication, the outcome is good, like you.
Yeah.
And sometimes we still don't have the best outcome, and in pain management, we need to continue to work sometimes and try the best fit. So,
I didn't feel like you were my doctor. I felt like you were on my team.
yeah.
After we had talked about what we were going to do and was it going to work, and you were very realistic about like, we'll give this a shot, it might not work, and then there's the next thing, but let's start here and see. So I didn't have like an unrealistic, I'm going to come skipping out of that office thinking everything's wonderful, and I pretty much did. Like I went home, slept for a couple hours, woke up and was like, how is this possible? Like I'm not feeling crazy amounts of pain.
Yeah.
So I didn't feel like you were writing a paper or needed someone else to try something out on, which I feel like with doctors a lot, that they're doing research and they want more test cases or they want more use cases, want to try some new thing that they've decided they're going to get famous for. And it didn't feel like that was it. It felt like you were, there's these few things we can do. Let's start here. And we had a clear plan.
Yes.
So
Awesome.
It was great.
Yeah, thank you. um, uh, anything else that you'd like to add, or I don't think I have any other specific questions. I just wish the best for you, and I hope that you continue to do well and continue to thrive.
Me too. I would just say, like, if anyone's doubting whether or not anything will help, and I was at that point with back pain where I'd gone to a bunch of different doctors, a bunch of different places. I had like 50 Botox shots in one sitting down my spine, like just insane things that doctors said would help, and nothing would help. And I got in that, I don't know that it's depression, but kind of that low of nothing's ever going to help, nothing's ever going to work. You have to do surgery. You have to risk being paralyzed. I didn't think that there was ever going to be an answer. And so when people would recommend, like, hey, have you tried this thing or, that thing, I'd be like, nah, it's not going to work for me. I'm glad that one day I just stopped deciding what a doctor was going to say and went to you and just to find out. Like, the conversation doesn't hurt.
Yeah.
And then if you're comfortable, it's the most amazing thing ever.
Yeah. Great. Yep. And I tell my patients that too, and I tell primary care doctors, other specialists and primary care providers that early on involving pain management is a better idea than later on, or after they've been put on opioids, or after they've already had surgery. It's
Yep.
early on for a more comprehensive look at what's going on, diagnosing the problem, really trying to find the focal pain generator, and to include pain management in the treatment plan early on is probably a better idea than getting our help when things are already
Yeah.
bad. So you're a great example of how well someone could potentially do, and I'm really grateful that you agreed to take this call and talk to us about your experience.
Oh, I'm super grateful. Like I really cannot tell you how different it is to not, like, my husband wants to go somewhere. I have to decide, like, is it worth the pain
Mhm.
to go somewhere with him? And now, like, I'm not making those decisions. I get to go and do stuff.
Yeah.
So you took me from being an observer in everyone else's life to getting to participate and not be the one sitting back, kind of just sitting there being miserable, actually being miserable and wondering how quickly we can get home.
Yeah.
So you did that. I'm super grateful for you.
Oh, thank you so much. Thank you. And yeah, look forward to just staying in touch and talking to you more.
Too.
All right.
All
All
right,
right, Miss
darling.
Vale. Yeah, thanks so much for talking to us.
Thank you.
All right, talk to you later.
All right. Okay.
Bye.